6 medications that cause dementia. Did you know that some of the pills you take to feel better might be quietly sabotaging your brain? While medications can save lives and ease symptoms, certain ones, especially when used long-term, have been linked to memory loss and even dementia. It sounds surprising, right? Why would a certain medicine meant to heal harm your brain? But that's the truth, and I'll explain how. First, let's be clear. This isn't about ruining modern medicine's reputation. To help you understand better, I'll explain what these medications are for, why they can cause dementia, and what you can do to protect your brain. So stay until the end, because I'll be sharing important steps you can do if you're taking any of these medicines. Remember, this video is for educational purposes only. If you have any health concerns and are taking any of these medications, please consult a healthcare professional before making any changes to your health. First, we have anticholinergic medications. These medications are used to treat a variety of conditions, including an overactive bladder, Parkinson's disease, motion sickness, and sometimes even irritable bowel syndrome. However, these drugs work by blocking a chemical in your brain called acetylcholine. Think of acetylcholine as a really important messenger for memory, learning, and just generally keeping your mind sharp. When anticholinergic medications block acetylcholine, it's like trying to send a message, but the phone line is down. This can make it harder for your brain to do its job. So, what's the big deal? Well, these medications can cause some fuzziness in your thinking. You might have trouble remembering things, concentrating, or just feeling mentally clear. Now, the longer you take these medications and the higher the dose, the more likely you are to have these issues. But it's worth knowing that even short-term use can sometimes cause problems, especially for older adults. Long-term use is linked to a higher risk of dementia. Examples are diphenhydramine, hydroxyzine, atropine, benztropine, tiotropium, and oxybutynin. Next is benzodiazepines. Benzodiazepines are good for treating anxiety and sleep problems, but they can also make your thinking a bit fuzzy. These medications work by boosting the effects of a brain chemical called GABA, which helps to calm your mind. Using them for a long time can mess with your normal brain function, make it harder for your brain to adapt and change, and affect your ability to form new memories. Research shows that taking these medications for a long period, especially for older adults, can increase the risk of developing Alzheimer's disease and other types of dementia. Examples are alprazolam, diazepam, and lorazepam. Next, we have opioids. These medications are prescribed to alleviate pain by blocking pain signals in the brain. However, they can also disrupt normal brain function. According to a Mayo Clinic study, opioids can negatively impact cognitive function in older adults. Long-term use of opioids can lead to tolerance, meaning higher doses are required to achieve the same level of pain relief. This can increase the risk of side effects, including drowsiness, constipation, and respiratory depression. Opioids can also reduce oxygen flow to the brain, leading to hypoxia, a condition where the body or a region of the body is deprived of adequate oxygen supply. Hypoxia can cause brain damage or even death if not promptly addressed. Furthermore, opioids can upset the balance of brain chemicals, making it harder to remember things and make decisions. A study of patients with chronic pain found that long-term opioid use was associated with an increased risk of dementia. Examples are hydrocodone and oxycodone. If you believe that these medications are affecting your cognitive functioning, talk to your healthcare provider. Next on our list are statins. Statins are medications that are really good at lowering cholesterol, which, as you probably know, is important for keeping your heart healthy. But like any medication, they can have side effects such as muscle pain, liver damage, and an increased risk of diabetes. Some researchers suggest statins might affect brain function by messing with processes that depend on cholesterol, but the evidence isn't clear. The link between statins and dementia is still debated. Some people report memory problems while taking them, but others don't. Examples are atorvastatin, simvastatin, and rosuvastatin. If you're taking a statin and you notice it affects your cognitive functioning, talk to your doctor. They can help determine if your cognitive changes are related to the medication or another factor and adjust your treatment plan if necessary. Sleep medications. These pills help you fall asleep but can have side effects. Over time, they can cause confusion, memory problems, and dependency. They also mess with normal sleep patterns, which are important for memory. Studies show that long-term use has been linked to cognitive decline and a higher risk of dementia. Examples are zolpidem and isoprene. Sleep medications are generally recommended for short-term use. If you're experiencing long-term sleep problems, it's important to address the underlying cause rather than relying on medication. If you found this helpful, don't forget to give it a like, share it to someone who needs it, and be sure to subscribe to get weekly health topics like this. Last but not least, antipsychotics. Antipsychotic medicines are used to treat symptoms of mental health conditions like schizophrenia, bipolar disorder, and severe depression. They work by changing the balance of chemicals in the brain, which helps manage really difficult symptoms like hallucinations, delusions, and extreme mood swings. Now here's the thing. While they're incredibly helpful for some people, antipsychotics can also have some long-term effects, especially on thinking and memory. Studies have found that older adults who use antipsychotics for a long time are more likely to develop dementia. Examples are haloperidol and risperidone. Antipsychotics are important medications for some people, but they're not without risks. Now, what should you do if you or someone you know are taking any of these medications? If you're concerned about the potential link between these medications and dementia, talk to your doctor. They can help you weigh the risks and benefits of these medications and explore alternative treatment options if necessary. Here are some important points to discuss with your doctor. Ask them why you are taking the medication. Is it the best option for your condition? Are there any alternative treatments available? What is the lowest effective dose? And how long will you need to take the medication?